If you've tried the meditation and the breath work, even the therapy and somatic work, you may have noticed that it helps for a little while and then your body snaps right back into tension, reactivity, or overwhelm. That does not necessarily mean that you are bad at self-regulating the nervous system. It means that your nervous system is likely still receiving a signal that says it's not safe to let go and repair. I'm Dr. Kenny, an IFM certified functional medicine practitioner, and identifying those hidden signals is a major part of the work that I do every day with my patients. In this video, I'll show you why your nervous system keeps reacting, what may be driving it underneath, and why the answer may not be another 60-second calming technique. Here's what much of the nervous system regulating content out there leaves out. These tools do work, and the research supports this, from the double inhale and the cold exposure or the somatic release techniques and even tapping. These are not placebo effects and are well documented. There is real physiological shifts that are happening behind these actions. The problem is what happens when you put these tools down in a dysregulated nervous system. Imagine your nervous system and regulation practices like a thermostat. The thermostat is not broken when it keeps returning to the same temperature that it's set to. This is exactly what it's designed to do. Tools like breathwork is basically like putting your hand over the sensor that reads the temperature of the room. It temporarily changes what the thermostat is reading, but the room temperature has likely not changed underneath that. So the thermostat goes right back to work. The nervous system reads that signal, the breathwork, the tapping, and it does its job accurately given what it's reading. A reframe that helps many people is not thinking of your nervous system as the origin of the problem, but rather a readout or a manifestation of the problem. Regulation techniques matter here very much because we need to change the average input that changes the nervous system output. But if you're using them to manage a signal without really ever asking what is generating that non-safety signal to begin with, you're really just working at the superficial level. You can also think of the dysregulation in the nervous system as communicating accurately, not a misfiring. It is telling you that something in the terrain of the nervous system, something below this output layer, has not been resolved and continues to add insult to the flame. And until that resolves, the system has no reason to update its calibration or change the temperature that it's set to. And research and what we know of the human body maps out exactly what's going on here. When the nervous system activates, it does so through two particular systems. One is your autonomic nervous system. This is the part of the nervous system that is not under your conscious control. Think breathing, think digestion. The other is what researchers call the HPA axis. This is the stress response pathway that runs from your brain to your adrenal glands, and it sets your baseline chemistry that is involved in your stress response. Both of these systems add up and feed back into the total burden of stress in ways that compound over time. What this means more practically is that if the stressors coming from multiple angles, whether you perceive them as stressors or not, are feeding these systems and they have not been identified or reduced, the nervous system has no reason to shift its baseline functioning. No breath technique, no tapping pattern can change that math of the inputs going into the nervous system. The signal keeps coming, and so the system keeps responding technically appropriately. And by the way, if you're one who likes the research, I've put together a free short research summary. It's in the description and the pinned comment below, and it pulls together the key studies and translates them for you into what they actually mean for someone living with this nervous system dysregulation pattern. So it's worth checking out alongside this video if you're one who likes the research. So let's talk about the terrain of the nervous system, a way that we can start to objectively classify what's affecting nervous system dysregulation to begin with. What is generating the signal that is so hard to shift or to influence in a long-term, meaningful way? This is where the answer starts to get more specific when we can tie it to data. For some people, the driver is hormonal. The stress response pathway, when we talk about the HPA axis, has three measurable stages of dysfunction. And when we're talking about HPA axis dysfunction, one of the hormonal markers that comes up is cortisol, what's also known as your stress hormone, if you will. But also its related hormones are part of the conversation here, but we'll keep it simpler for the purposes of this discussion. Stage 1 HPA axis dysfunction patients can often begin to shift their chemistry within about 3 months of consistent support. Stage 2 and stage 3 patients can take anywhere from about 6 months to 2 years or more, depending on what else has been compounding in their systems and added to that load of stress over time. This is what recalibrates the actual chemical part of the nervous system and stress response. So that range shouldn't necessarily be discouraging. It is honest, and it honors the complexity of stress chemistry and nervous system dysregulation in the body over time. For other people, the driver underneath is often immune system dysregulation, chronic low-grade inflammation or infections that are hidden in the gut, for instance, or perhaps poor immune activation through chronic stress chemistry. It's all connected here. The kind of inflammation that often doesn't show up on standard lab panels. These are the things that keep feeding the system and provide the same signals that keep the nervous system stuck in that chronic dysregulated mode. And unfortunately, while tools can be powerful to give you some temporary relief, such as the breathwork and the tapping and the nervous system dysregulation, if these major drivers are not addressed underneath, oftentimes it keeps the body stuck in a cycle. And for a significant number of patients that I work with, the driver can be environmental as well. Think biotoxin exposures or overall toxic and allergen load. This creates a specific pattern of persistent nervous system activation that, as long as those factors are present or in the same amounts, the nervous system can't truly budge and shift into more of a healing and tolerant space. So a pattern that I see regularly with patients who hit those walls with nervous system regulation techniques is that there are different underlying drivers underneath, oftentimes a combination of drivers especially. So a patient who's doing the work, the breath work, the somatic work, maybe even EMDR and trauma processing, they may genuinely feel better while undergoing those techniques, but they're returning to the same environment, the inflammation, the immune dysregulation, the environmental toxin load, the family and home stressors. And within days, their same nervous system state has returned because the environment did not shift. This concept, this idea is not theoretical. Research is also starting to put objective data to this very real lived experience. Research on post-viral syndromes and illness gives us precise examples of exactly this mechanism. What the researchers found is that inflammation that is persistent and associated with viruses can reduce the amount of available serotonin. Serotonin is the chemical neurotransmitter that helps to regulate mood and calm and is especially concentrated in the gut as well. And it does so through two main routes. Number one, it changes how the gut absorbs it. And number two is through what's called platelet hyperactivation. Platelets are the blood components that are involved in clotting. And in this pattern, they were taking up serotonin at unusually high rates, pulling it out of circulation. That reduction in available serotonin directly impairs the vagus nerve. The vagus nerve is the two-way nervous system pathway that connects the brain and the gut. And breathwork can create noticeable shifts in the tone and the ability of this vagus nerve to activate. A conversation that also enters the nervous system dysregulation piece that deserves some attention is the idea of a threshold. This is a concept worth understanding because I think it creates a lot of softness around understanding why reactivity often exists in a dysregulated nervous system. The problem with this threshold conversation, though, is that it's often a moving target. Your threshold for how much it takes to activate your nervous system can change based on all of the factors we just talked about. How much stress load or immune load or inflammation load or beyond is contributing to the total load your body and nervous system are experiencing. That moving target makes this work very difficult and sometimes feel illogical when you're going through this process. This is also why early nervous system dysregulation can be very tricky to catch, because your threshold often maintains a certain amount of resilience until it doesn't. And often it's a major life transition or a healing event or something similar that just tips the scale in a big way. And I know we often think of nervous system dysregulation in the context of mental health, but interestingly, early nervous system dysregulation signals appear in some of the areas associated with inflammation and immunity. Think the gut health, think slower bowel movements, or maybe increased chemical sensitivity, or a lower tolerance for stress. Not immediately mental health conditions like depression and anxiety or PTSD even, although of course there is overlap. And I'm curious, for those of you who have done some of this nervous system dysregulation work, what has your experience been like? Have you noticed that up and down experience, but feeling like the baseline truly isn't moving? Was it sudden? Was it gradual? Were there certain techniques or systems that worked really well for you? Drop it in the comments below. I'm sure people following along would love to read about your experience. And because we're really talking about the chemistry a lot in this nervous system dysregulation conversation, I want to be sure to name that the cognitive and emotional work absolutely matter as well. You cannot separate the cognitive from the chemistry, and that's something I want to be very clear about. Our thoughts move our chemistry. The patients that I work with who tend to make the deepest and most lasting changes are almost always the ones who are doing the cognitive work on the side as well, whether with a therapist or a somatic practitioner. They're addressing relationships to their experiences and their relationships, as well as the deep trauma work, for instance. All of these pieces deeply matter. Stress chemistry, and I use the term stress chemistry deliberately because we're not just talking about our societal understanding of emotionally perceived stress. It's not a negative thing. Stress chemistry does not require a perceived threat to be active in the body. Hidden infections, hormonal disruption, immune dysregulation, environmental toxins, stressful households, even in the relative absence of this perceived psychological stress. So definitely sit with that if that's something that's hard to conceptualize when it comes to talking about stress chemistry. But the reverse is also true. Many patients, by the time they come and see me, have spent months, years, even decades of questioning whether or not they're even experiencing what they're experiencing, because the conventional model doesn't always have a language that matches up to the spectrum of experiences. And the cognitive weight of chronic illness alone becomes its own terrain input. The fear of symptoms, the exhaustion of not knowing, having to go to the next doctor's visit, the disappointment of not having answers or those normal labs. These are not only emotional signals, but they are also chemical ones. And this is why I'm such a proponent for structured nervous system work, the breath work, the bilateral stimulation, the cold exposure. The list goes on, not as the solution to the terrain, but as a real and meaningful way to interrupt the default chemistry that's happening underneath. These tools absolutely matter, and these inputs can be powerful, but we also need to make sure we're addressing the inputs that are keeping the nervous system stuck in the first place. There's a lot of really great tools out there that help to stimulate this part of the nervous system that sends signals of safety. And we're talking about the vagus nerve and parasympathetic nervous system, or that rest and digest nervous system stimulation. And let's talk a little bit about the general research here. Research on vagus nerve stimulation, direct activation of the vagal nerve, usually it's along the throat or similar areas, found real reductions in systemic inflammation, as well as improvement in symptoms associated with autonomic nervous system disorder. The autonomic nervous system, again, is the part that runs in the background without your conscious control. But the researchers were also clear about the limitations of these studies. Oftentimes, the evidence is very small. It comes from pilot studies, and we need large-scale analysis to know how much of an effect these external tools of vagal nerve stimulation truly help. They can only help, but How much as a standalone tool or therapy remains in question. So definitely don't stop using your vagal nerve tools. There's a lot of different ones out there, and even some free ones like simply singing or gargling and humming. These help to activate the vagus nerve in the throat. But use these tools with that understanding that they are just tools as part of the bigger picture and part of a deeper investigation oftentimes. So use the tools that you've been given when dysregulation arrives. It helps to redirect and send the safety signals that can in the moment become a long way. And there are tons of videos out there on the internet about the quick 30 or 60-second nervous system resets. If you'd like, in the comments below, let me know if you'd like me to put one of those together for you. Otherwise, check out the resources. And if this thinking is resonating with you and you would like my eyes on your case, if you're in one of the states that I practice, the next step is to watch a free training that's linked to in the description below. It prepares you for a health mystery map call where I get a better understanding of your case and whether or not the type of functional medicine work that I do matches up with your next goals. What this video didn't really go into is what the terrain investigation often looks like when it comes to nervous system dysregulation. There's so many underlying causes that can contribute, but one of the ones that's sneakiest is often mold and mycotoxins. They have this ability to hijack the nervous system and blunt its effects or abilities to come back online and truly support your healing. If that's something that interests you, or you've been suspicious of mold exposure or mold toxins in the past, that's exactly what this video goes over next, so check it out. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.